brush your teeth, use mouthwash, even chew gum, floss your teeth, and your breath still smells bad, well, that's called halitosis, as you know. And in this video, we're going to go over 5 different reasons why your breath smells bad and what you can do about it. Now, these reasons aren't all inclusive. They don't cover every single issue or cause of it, but just the general causes and what you can do today to get that bad taste out of your mouth. Because I know how it feels. I've had several patients come to my practice, even myself, and notice that you brush, floss, use mouthwash, toothpaste, gum, candy, mints, and that bad smell, taste is still there. What can I do? Well, that's what we're going to talk about in this video. My name is Mike. I'm a dental practice owner of Charles Family Dental right here in Houston. That's not the most important thing. The most important thing is getting your situation handled. But what we're going to do before we do that, I'll need to let you know that this video is for general educational purposes only. Every person's different. Your medical history, your medications, and your condition, they all matter. If you're unsure about anything recommended here, check with your physician, your dentist, your pharmacist, make sure they're all licensed, and get your questions answered before proceeding. Okay? Now, that's a simple explanation of why there's a bad taste in your bad breath, bad taste in your mouth. Let me explain this simply. Bad breath comes from bacteria. These bacteria live in your mouth, and these bacteria produce gases, and those gases smell like sulfur. You know, the same smell as rotten eggs. That's the sulfuric smell. And when you know how rotten eggs smell, it doesn't smell good at all. But that's the sulfuric smell that bacteria, which live in your mouth, can emit after they eat the things that you eat, that bacteria eat as well, and they give off gases. But those gases can affect your breath. So the goal is not just to cover the smell, but to remove the cause. So reason number one, the number one cause of bacteria or bad breath in your mouth, bad taste in your mouth, is bacteria on your tongue. Your tongue has a rough surface, and if you don't brush your tongue on a regular basis as you do your teeth, those bacteria can live in the crevices on your tongue, and they can eat when you eat, and when they eat, they give off odors, that rotten smell. What can you do about it? Well, starting today, I want you to go and get what's called a tongue scraper. Now that sounds gross and everything else, but all it does, you place it on your tongue and you gently remove the accumulations that are on your tongue. You just slide it forward. Put it on your tongue, press gently, and slide it forward. And if you look down, you see all that gunk on there. Well, that's the bacteria. That's the bacteria and the gunk that they eat that are on your tongue. And that stuff, it can be the source of the bad taste, bad smell that's coming out of your mouth. So when you brush your teeth, I want you to clean your tongue, scrape your tongue as well. It'll make a big difference. Okay, starting today. The second thing I want, the second reason for bad taste, bad smells, bad odors in your mouth, a second reason could be gum disease. Okay, this happens when bacteria gets under your gums and causes an infection that produces a strong odor. What can you do? Well, if your gums bleed or look swollen, you need a professional cleaning. At home, what you can do at home is brush gently along the gum line and floss daily. I know people don't like to floss, but actually, floss in some cases might be as important, if not a little bit more important than flossing. When you floss, when you put the floss between your teeth with a floss holder or with you flossing by hand, when you put the floss between your teeth, go up and down. Don't go back and forward because you will be sawing your gums and make this problem worse because then you'll be introducing those same bacteria within your bloodstream, and that's a whole another host of problems. But for right now, a potential cause of bad breath, the bad smells in your mouth, is bacteria under your gums. So what you can do at home, brush your teeth, floss your teeth on a regular basis, and then we'll get to the other steps of what you can do at home. There's several things you can do away from the home, like visiting a dentist, visiting a hygienist, have him or her clean your teeth on a regular basis. But right now, we're talking about things you could do at home to take care of those bad tastes and bad flavors. The second cause of bad odors or bad taste in your mouth is dry mouth. Some people have dry mouth. Saliva is very important. It washes away bacteria. When your mouth is dry, bacteria builds up and the odor increases. It's kind of why your breath smells worse in the morning because as you sleep, your salivary flow tends to diminish. So less salivary flow, more bacteria doing what they do, giving off more odors. That's why the breath can be stronger in the morning because your saliva can flow less in when you're sleeping, causing the bacteria to emit their gases even more. So salivary flow is important. So if you have dry mouth, that's the third cause of having bad breath. And what you can do with that at home, drink more water and be aware that some medication can cause dry mouth. So some things you might be taking if you have any conditions that can cause dry mouth, it might be your medications. So if that's the case, check with your physician, check with your dentist if you have one. Let him or her take a look at what you're taking and see if that's one of the causes. Okay. Number four, the fourth reason of having a bad taste, a bad smell, a bad odor in your mouth is your diet, food and diet. Now, I'm like anyone else. I love food. I love candy. I love sweets. I'm a dentist and I love candy. But I make a choice that if I'm going to eat those things, that I clean my teeth immediately afterwards. And that's what you should do. If you're going to eat the pizzas and the hamburgers and the nacho chips and all that, which we all love, not all of us, but some of us, you're going to have to take care of your teeth. Garlics, onions, spicy foods, things like that. They get those, that food gets absorbed in your bloodstream and it gets released to your mouth. Garlicky, things like that. I love Italian food, for example, and spicy foods. When you eat that stuff, man, sometimes it gets absorbed through your bloodstream. What can you do at home? Well, you're going to have to limit these foods even though you like them so much. You're going to have to stop going to Domino's Pizza, stop going to Papa John's, stop going to Star Pizza, for example. Or if you're going to do those things, make sure you brush and floss almost immediately afterwards to get that smell off your teeth. Because if you get that garlic on your teeth and it's not removed, it's going to release, going to give off bacteria. Secondarily, if you eat those things, you're going to get those things in your bloodstream and they're going to get into your system, and those same bacteria are going to emit those gases through other means. So, your food, your diet has a lot to do with the way your mouth feels and the odors that are emitted. So, what you can do at home, watch what you eat, or clean your teeth immediately afterwards. If you're going to eat those spicy things or garlicky things, one thing you might want to do is eat vegetables with it. Vegetables, lettuce, kale, things like that can help clean your teeth as well and remove those things from your teeth before you even get a chance to brush. So if you're going to pay, so if you're going to pay with garlicky foods, you're going to have to, I should have said, if you're going to play by eating spicy foods, you're going to have to pay by taking care of it. Pay to play, for example. Anyway, uh, what you can do is, like I said, limit these foods, drink water, chew sugar-free gum, but remember this is temporary. The root cause still remains. Now, the fifth thing that causes bad breath or bad odors is tooth decay or infection. You know what this is. Rotten teeth, teeth that have gotten to the point to where the decay has gotten to the inside part of the tooth, and those are that's bacteria again. Bacteria emits gases and odors. So when you have a bad rotten tooth in your mouth, that can be a cause of bad breath, bad odors, bad taste in your mouth. So those are the five different reasons that you can have these problems, and you're going to have to take care of that. Now, it's not going to go away on its own. Now, what can you do at home? If you have persistent bad breath or tooth pain, you're going to need a dental exam. You're going to have to go to a dentist somewhere, a licensed dentist, and have him or her take a look at that, take an x ray if necessary, and see what's going on and render treatment. It's not going to go away on its own. You can use mouthwash, for example, while you're at home, but remember, that's a temporary fix. It's not going to solve the problem. It's just going to bandage over it and make your breath or your mouth feel better for a while. But the problem, the toothache, if that's the cause, it will return. So if that's the cause, get to a dentist, let him or her take a look at that and see what the problem is and address it. Because it's only going to get worse, it's not going to get better by itself. So a quick summary of the five reasons for bad breath, bad taste in your mouth. Number one, check your tongue, make sure your tongue's clean. Number two, Check your gums. Make sure you're keeping your teeth clean. Number 3, stay hydrated. Make sure you drink enough fluids. Number 4, watch your diet. Make sure you don't eat a lot of spicy, sticky, high, high garlic. I want to say caloric, high garlicky foods without brushing your teeth right afterwards. And the last thing is rule out decay or infection. Okay, if you fix the cause, you'll fix the problem. So if you're in the Houston area and you've been dealing with bad breath for weeks or months, it's time to get to the root cause. It's not going to get better on its own. Contact any dentist, ask your friends, neighbors who they recommend for a dentist. All dentists in Houston are highly qualified in treating this situation. We've been, have experience with this for years and can help you get over this problem. Or you can call the local dental society. They have dentists that they can refer you to. You can call 1-800 dentist if you don't have a dentist and get your questions or problems handled. Like I said, they won't go away on their own, but get to a dentist right away, a licensed dentist, and let him or her get to the cause of the problem and help you figure out what's the best way to handle that. If you don't have a dentist at all, you can always come to me. I'm Dr. Charles. Again, I'm not soliciting patients or anything. I'm just letting you know that get help. Get help somewhere. Don't just sit around and say, "Oh, I'll just rinse my mouth out with water and it'll go away on its own." No, there's something things you're going to have to get addressed by getting professional help. So if you like this video, go down to the bottom, click the thumbs up, click the thumbs down, put in the comments what you like, don't like, let me know what I can do to change it and make it better for other people. But let me know, and I'll be right back here next week to let you know what other techniques you can do to take care of your teeth and make them last as long as you are. Okay, that's it for now. I'll see you next time. Bye.